Okay, welcome everyone to the Qatar Association Health Seminar 2021 on the benefits of lifestyle medicine. As you know, during the lockdown, Qatar Association has been running regular online seminars. We've also been running online yoga sessions and also providing hot food deliveries to those in need during this troubling time. And of course, we're carrying on our work, rekindling Qatari history and culture. And we've also got the Janiyamana Grove project running. So without further ado, what I'll do is hand over to our guest today, Sonia Gandhi, who is a GP and a lifestyle medicine practitioner. So if I can hand it over to you, Sonia, please.
Thank you. Good afternoon, everyone. Thank you, Mr. Chanchal Chowdhury and Mr. Bhupinder Basan and the Qatar Association for inviting me along this afternoon to discuss with you all the benefits of lifestyle medicine in a world of chronic disease. So just a bit about my background. My name is Dr. Sonia Gandhi. I'm an NHS GP working at a practice in Southwest London. I have a special interest in dermatology, and I'm also a certified lifestyle medicine physician working as a doctor at an online service called Plant-Based Health Online. I'm also an educator in lifestyle medicine and plant-based healthcare, and I'm available for lectures and workshops. And in my spare time, I host voluntary community walks as part of the Walk with the Doc initiative. So I've been invited today to speak to you about lifestyle medicine, as you may know, but you might be wondering what this is. So over the course of the next 45 to 50 minutes, I'll take you through this emerging specialty, explaining what it is, why it's relevant, and why it's particularly relevant to the Asian community, and how we can all make simple adjustments in our lifestyles for the betterment of our health. So let's move on to the definition. What is lifestyle medicine? Well, lifestyle medicine, oops, I'm so sorry, there's a picture that's not come up on your screen. It's an evidence-based treatment management option for the prevention, treatment, reversal of chronic disease with common lifestyle interventions. And those are healthy eating, predominantly based on a plant-based whole foods eating pattern, activity or physical activity, stress management, sleep, optimal sleep, positive relationships, and the avoidance of risky substances. And these are all things that are in our control, and we know we should improve, but generally we have difficulty in doing so. So why? Why is this important? Why does lifestyle matter? Well, chronic conditions are common, and globally, I mean, throughout the world, of all the diseases, 60 to 70% of them are chronic in nature, meaning they are non-infectious. And if we look at the UK specifically, up to 50% of general practitioner appointments are due to chronic long-term conditions, 64% of hospital outpatients, and up to 70% of inpatient beds are taken up by patients with chronic conditions. And the NHS spends a staggering £14 billion each year just on diabetes care alone. So let's look a little bit down at cardiovascular disease. Now, this costs the NHS approximately £9 billion per year. And currently about 7.6 million people in the UK suffer from a form of cardiovascular disease. There are about 100,000 hospital admissions due to heart attacks each year. Every 5 minutes, somebody will suffer from a stroke. And 28% of adults have high blood pressure. Now that equates to approximately 15 million people, of which 1/3 are currently undiagnosed. So every day, you know, we're talking about 450 deaths, and per year, of all the deaths that occur in the UK, 27% of them are due to a cardiovascular disease. Now let's look at the risk factors for common chronic diseases such as cardiovascular disease and diabetes. Well, we've got high BMI, that's obesity, high blood pressure, poor sleep, a sedentary lifestyle, not having enough exercise or movement, stress, poor diet, high glucose levels, high cholesterol, smoking, and excessive alcohol. So the question really we need to be asking ourselves is, how many of these risk factors can we actually manage ourselves through our lifestyle choices? Now, if we just look at chronic conditions and the situation with Asians, we know that people of the Indian subcontinent are 6 times more likely to develop diabetes than those of the Caucasian population. And in 2010, the South Asian Foundation estimated that approximately 15% of the diabetic population were South Asian in origin. And comparing that to the 2011 population of England and Wales were Asian. So that's quite an alarming statistic there. I do apologise. I had some paper here to show you, but for some reason the picture's not being displayed. I do apologise. If I can get the slides through to Portal Association later on, I will do. Then if we look at chronic heart disease in the South Asian population, again, I have some papers, journals, which I had put on the slide, but they're not showing. Well, coronary heart disease is the most common cause of premature death in the UK. And we know that UK South Asians have a 40% higher death rate than Caucasians. And there was an interesting article here, which you can't see, I'm sorry about that, by a study that was conducted by Patel and his colleagues in the Lancet in 1995. And it showed that Punjabi migrants who came to the UK in 1995 had higher blood pressure, higher sugar levels, higher cholesterol, higher body mass index compared to their siblings that remained behind in Punjab. So there's obviously something that was going on about the lifestyles that the Punjabi immigrants to the UK acquired that was increasing their risk factor for cardiovascular disease. Now, I'm aware that the situation is changing in India, and due to the adoption of similar lifestyle patterns in terms of diet and a sedentary lifestyle, that they are also now suffering from increased chronic disease in terms of cardiovascular disease and diabetes. Now let's look at chronic conditions and COVID. I'm really sorry about this because there's some interesting tables that I had here which reported, it was a paper by Public Health England, and it examined the disparities in the risks and outcomes of COVID. And I was going to show you the table on the right that showed that between the months of March and May 2020, there were high underlying chronic conditions that were reported in COVID deaths, including diabetes and hypertension. But there were some papers there, the Public Health England paper, which examined the outcomes of COVID and chronic disease. And then the same public health report went on to say that deaths from COVID were higher in the Black and Asian minority ethnic groups in comparison to the white population. And Bangladeshis were actually at double the risk of death from their white British counterparts. So I just wanted to also talk about vitamin D and COVID. And the reason is it's a question that I get asked about very frequently. And I think it would be remiss of me not to talk about vitamin D and COVID, because it is a particular problem with Asians. Whilst we've known that since the early 1920s, vitamin D plays a crucial role in bone health and preventing rickets, it's since been discovered that vitamin D regulates more than 200 genes and plays a significant role in immunity, both in terms of preventing infection and in preventing autoimmune conditions. Now, we know that vitamin D is actually not a vitamin, but a hormone, and it's produced in skin when you have exposure to sunlight. And because it requires the ultraviolet UVB rays from sunlight, it can only be obtained from sunlight outdoors. So sitting by a glass window will not help because it will block out the transmission of the UVB. And for paler coloured skins, you require 10 minutes of exposure in direct sunlight. And for darker coloured skins like Asians, we require a bit longer, 25 minutes. But the problem is living in a country like the UK, which is in the northern latitude, is that we, between the months of October to March, we just don't get enough UVB from the sunlight to allow for that activation of vitamin D in our skin. So that's why the government actually recommends that we should all be taking supplements, irrespective of your skin color or your ethnicity. Now, currently they recommend 400 units a day, but there is some discussion about increasing this recommendation to 1,000 to 2,000 units a day. In 2017, there was a professor who looked at the link between vitamin D and respiratory tract infections, and he actually showed that vitamin D can protect against respiratory infections. So extrapolating from that, we would assume that vitamin D would protect or have a role to play in the prevention and protection of treatment of COVID. But at the moment, the data is not conclusive, but there is growing circumstantial evidence to suggest that this may be the case. So I think given the fact that Asians tend to be deficient in vitamin D and we have an increased risk of chronic disease, I think it's really sensible and important that we are all taking our vitamin D supplements. So how do we improve lifestyle? Moving on to the second part of the presentation. Well, I'll just take you through a quick tour on improving lifestyle. We now know that there are decades of research around lifestyle interventions, and there's growing interest because there's an awareness of the poor quality of life that we have with chronic conditions and earlier death. And a staggering 48% of the UK population are currently on at least one prescription medication. So there is a real need to address this situation and look at, whether we can reduce our requirement for medication. And also there's the growing spiraling healthcare costs to the NHS. But equally, it's also about the growing, taking personal accountability for our own health. So I can't cover all the information, but some key areas that I will touch on today are healthy eating and the gut microbiome, sleep, exercise, stress, relationships, substance misuse, and how this is all interlinked with chronic inflammation, which leads to chronic disease. So let's move on to chronic inflammation. That was the paper going back about diabetes risk in Asians. This was the papers to do with coronary heart disease. And then we have the Public Health England paper with looking at the risks of cardiovascular disease and COVID. This was the papers to do with vitamin D and COVID. And then if we look at inflammation.
Okay, good. You're on.
We're on, yeah. So what is inflammation? Well, inflammation can actually be a good thing. It's when you might notice when you've cut yourself or you've had a scratch or injured yourself, that area becomes red, hot, tender and swollen, and that is inflammation, and it's a good thing. But the problem is that when that inflammation doesn't resolve, it then converts into chronic inflammation. And chronic inflammation is actually goes on to cause a whole host of chronic diseases such as heart disease, diabetes, cancers, allergies, and other chronic illnesses which can be very problematic. So what can we do about managing inflammation? Well, we have to then look at our nutrition and microbiome, the gut microbiome. Now, I'm just going to explain to you a little bit about what the gut microbiome is. You may have heard of it, but you might be wondering what it is. Well, the gut microbiome is an ecosystem of organisms such as bacteria, viruses, protozoa, that are all living inside our gut, and that's also including their genes as well. And they outnumber the human cells by a factor of 10 to 1. And so they live on us and inside us as well. And they're vital to our healthy functioning. They are vital to a healthy immune system. They are important for the production of some vitamins, such as vitamin K. And also they produce something called butyrate, which is a short fatty acid. And this is only obtained when the gut bacteria digest on fiber, and that's fiber that they obtain from eating whole plant foods. You can see the link that if you don't have a healthy gut, you're then going to end up with problems with chronic inflammation and then chronic disease. I'm going to explain to you a little bit about what leaky gut is, because leaky gut is the outcome of having a poor gut microbiome. So just a little bit of an anatomy lesson here. The gut, the gastrointestinal tract, is a long tube which extends from the mouth to the anus, and it connects with the outside world. And this is important to know because the mouth is also home to its own oral microbiome, which has a crucial role in maintaining our health. And food that we eat, that food is essentially information. And when we eat, we're actually priming our cells to absorb that information. So the chewed food, once the salivary enzymes have acted on it, make its way down into the stomach and towards the intestine. And here, various nutrients are extracted from the food that we've digested, and any waste product is excreted as stool. Now, 70% of our immune system is actually located in the gut, and the gut is lined by a layer of cells called, which are actually interlinked tightly together by what we call tight junctions. Now, if these tight junctions get disrupted due to stress or toxins or processed food, infections or medication, then these tight junctions open up, predisposing to a condition called leaky gut. So all the toxins that were in our gut will then get into our immune system, which then triggers off an immune reaction, inflammatory reaction, which then feeds into poor health. So what factors lead to this poor digestive health? Well, we know that eating a Western pattern diet, the standard American diet, because it's rich in saturated fats, it's rich in refined carbohydrates and refined sugars, and all of these disrupt the gut microbiome. But also the standard American diet contains a lot of food preservatives, and food preservatives are like detergents. So they actually erode the lining of the gut, damaging it. And fizzy drinks do the same thing as well. So all that bottle of Coke that's lurking in your cupboard, that is just as disruptive to the gut microbiome as preservatives are. The exception to that is sparkling water. Now, our alcohol, that is also a disruptor to the gut microbiome because it's a sterilizer. So it sterilizes the good bacteria as well as the bad bacteria. And we also know that shift work and certain medications such as metformin for diabetes, omeprazole for reflux medication, antihistamines, Drugs like ibuprofen for painkilling relief, and antibiotics, all of these also disrupt that healthy gut microbiome. So what can we do to look after our gut? Well, it's primarily centered around the consumption of plants, whole food plant-based diet, vegetables, fruits, whole grains, legumes, seeds and nuts, lots of fruits and vegetables, having a wide variety, at least 30 different types per week is what we advise. You know, we talk about eating the rainbow, having lots of different colors of fruit and vegetables each day. I'd aim to have at least 5 portions of these fruit and vegetables a day. Also, things like citrus fruits, oranges, kiwis, lemons, these are rich in vitamin C, all very helpful in maintaining our immunity. And berries such as blueberries, raspberries, blackberries, these contain compounds called polyphenols, which again are very helpful in maintaining our health, preventing chronic inflammation, and they also are very important in maintaining brain health as well. Vegetables, green leafy vegetables, these are rich in something called nitrates, which are heart protective against heart disease. And spices and herbs, you know, every Asian household will have that ubiquitous spice tin, and that spice tin is bursting with an array of antioxidants and anti-inflammatory compounds, such as, you know, you've got turmeric in there, cinnamon, cardamom, all these things are so good for our health. Also fermented foods like kimchi and sauerkraut, these help boost the probiotic aspect. So the prebiotics are what the gut bacteria feed on, and those are obtained from the fiber from all of this, from eating around plants. And probiotics are actually the live cultures which you find in these types of food. Now, other things that can improve gut health are time-restricted eating. You're eating within a 10 to 12 hour window, avoiding or minimizing the amount of alcohol that you drink. If you are going to, then red wine is probably better than spirits because of the polyphenol content. Of us avoiding smoking. Decreasing, as we've discussed already, processed foods such as saturated fats, refined sugars, refined carbohydrates, optimizing your sleep patterns, and I will go on to talk about that later on. Exercise, stress management, all of these will help improve your gut health. Now, note that the Indian vegetarian diet, whilst it's very rich and diverse in its plants and its vegetables, fruits, also use of legumes, lentils, etc., beans, is actually very rich in dairy, and dairy is high in saturated fat. And this saturated fat can actually go on to lead to diabetes, heart disease, and cancer. So that's just something to be very cautious about. So let's move on to sleep now. So sleep is often an undervalued and underrated aspect of our lifestyles. It's one of the most important pillars of good health. You know, we all know that when we've had a good night's sleep, we make healthier food choices the next day, we exercise better, we feel better in ourselves, and we have better relationships with those around us and increased productivity as a result. Now, 1/3 of the human lifetime is actually spent on sleep. And, you know, we might think that during sleep we are resting, but actually the body is busy optimizing its immune system during this time. It's regulating its hormonal balance. You know, growth hormone is secreted at night, and growth hormone is required to repair that gut lining that we need to keep us healthy. Also during sleep, we are excreting toxins from our brain. And sleeping well, having good sleep is associated with improved mood, improved memory, improved concentration. And it goes to say that, you know, if you have impaired sleep, We have detrimental effects on our health. There's an increased risk of depression, anxiety, obesity, heart disease, decreased memory, cognition, immunity is affected as well. And obviously it makes us more tired. And the UK Sleep Council estimate that about 40% of people suffer from sleep issues. And we really, as adults, require 7 to 8 hours of sleep every night. Now, these two slides just summarize how sleep, the pattern of sleep, what sleep is made up of. It's made of consists of two phases. The first phase is quiet sleep, and it tends to dominate the first half of sleep. It's also known as NREM, that means non-rapid eye movement. And it's during this phase that detoxification occurs. So all those sort of bad toxins are removed from our body. The latter half of sleep, as you can see from here, 4 to 8, is dominated by these pillars, which is active sleep, and that's called rapid eye movement sleep. And it's during this phase that our brain is very active. During this time, our learning is enhanced, our memories are enhanced. And if we've had any painful or anxious situations in the day before, those are extinguished at this phase of sleep. So you can see that compromising on the hours that you sleep, on sleep quantity, will actually have a huge impact on your sleep quality as well. So what's happening in sleep? Let's look at the sleep biochemistry. Well, sleep biochemistry depends on two hormones. We have a hormone called adenosine and a hormone called melatonin. Now, adenosine is a chemical that's released in the brain, and it's released in increasing amounts for each hour that we're awake. So high amounts of adenosine increase our desire to sleep. But the problem is that coffee latches onto the adenosine receptors and it blocks them, it inactivates them. So therefore, it increases our feeling of alertness. So that every time you're having a cup of coffee, that coffee takes at least about 7 hours for it to be excreted from our bodies. So the more coffee or tea or coffee or anything with caffeine that you're having, the less sleep pressure you're going to have, and the increased incidence of being alert. Now, on the other side of the scale, we have a hormone called melatonin. And melatonin is a hormone that is released by a small gland in the brain called the pineal gland. And it's released in tune to the circadian rhythm, which is linked to the daylight, day and night cycle. So during the day, we have the sun shining, and it blocks the production of the sleep hormone melatonin. At night time, when the sun is not shining or we don't have exposure to light, then the pineal gland gets activated and lots of melatonin is secreted, which then helps us fall asleep. So what can we do to help us fall asleep if we're having trouble? Well, as I said, we really need to be aiming for 7 to 8 hours of sleep per night. Aim to have a regular sleep time, go to bed the same time every night, try and wake up the same time every day. And having a morning walk, particularly before lunchtime, helps to regulate that circadian rhythm, which will ensure that you're getting the melatonin being produced at the right time of the day when you need it. So, having a morning walk every day is very, very helpful. Exercising, aerobic exercise, where you get your heart rate up and you're out of breath and sweaty, that can also help sleep. But just be cautious that you're not doing that too late at night, because it can raise your core body temperature, and that can then prevent you from sleeping. Now, this is a big problem, digital devices. We've all got mobile phones now, we all have iPads, we might all have access to Netflix or similar streaming platforms. And the problem with these activities is that they emit something called blue light. It's the same blue light that you find in sunlight. And the blue light blocks the melatonin production. So if you're up scrolling on your mobile phone or checking emails just before bed or even in bed, then it will stop you from sleeping because melatonin is not being produced. Also, avoid caffeine after lunchtime, which we've already discussed because of its long half-life. Try and eat within a 10 to 12-hour window. Try and ensure that your last meal is about 2 hours before bed so that your gut gets the opportunity to rest. And relaxation. So relaxation really involves any activity in which you're winding down. So reading a book, listening to calming music, doing yoga or deep breathing, having a warm bath. And as we've just alluded to already, there's been a study that showed that having 2 golden kiwis about 2 hours before bedtime can help induce sleep. And the same thing with pistachios. You just need to eat 2 or 3 pistachios to get the same effect. And that's because these foods contain a chemical called tryptophan, and the tryptophan converts into melatonin, which is the sleep hormone. So let's now move on to exercise and physical activity. Why is exercise important? Well, use it or lose it. Sarcopenia is a huge problem. Sarcopenia is the loss of skeletal muscle that occurs as we age. And if we lose that skeletal muscle, it will lead to poor health. And we know that if you are inactive from about the age of 30 onwards, you start to lose approximately 3 to 5% of your muscle mass each decade of your life. And we know that by the time you get to your 80s, about 50% of people have sarcopenia. Now, why is this a problem? It's a problem because sarcopenia is linked to frailty. Having poor skeletal muscle health increases your risk of falls, fractures, and loss of independence. We also know that by not exercising, you increase your risk of cancer, heart disease, stroke, diabetes. There's up to a 30% increased risk of these conditions. And just by taking a 15 to 30-minute brisk walk every day, you can actually decrease your risk of these conditions. And the benefits of physical activity also extend far beyond that. Physical improvements, health-wise, are obvious. Mental improvements, it decreases depression, anxiety, it improves mood, concentration. It also improves our supports our immune system. And then also the societal benefits. When we are exercising, we might be doing it in a gym or in a class. So we then, we improve our social networks and make new friends. Sorry, just excuse me. So what should we do? How do we exercise? Well, the government recommends that we should be exercising for a minimum of 150 minutes per week of aerobic exercise. And that also 2 to 3 strength training resistance sessions per week. Now, it's not necessary or beneficial to do that 150 minutes in one go. You're actually better off spreading that throughout the week. And if you're struggling to do a block of 30 minutes, then break it up into smaller chunks, 10-minute chunks. And throughout the day is far better than trying to do a large block if you're struggling to do that. And join a gym or exercise classes, or enroll with a PT if you need some help getting started. And as we age, it's really important that we maintain our flexibility. So stretching every day for 10 minutes, 2 to 3 times a week is essential. And also balance. Again, due to the aging process, our sense of balance can be diminished. And in order to preserve and enhance this sense of balance, which will then help reduce falls, we should be aiming to do at least 20 to 30 minutes of yoga or Tai Chi 3 days or more per week. Ideally every day, but at least 3 days a week. But remember, you know, movement can happen at home. It doesn't have to involve formal structured exercise. Get up, move every 45 to 60 minutes. You know, being sedentary on its own is an independent risk factor to chronic disease. So get up off your chair every 45 minutes, move. Even if you just go to another room or have a stretch, that's going to be helpful to your long-term health. And remember, housework is movement, gardening, incorporate movements into everyday tasks, and use stairs wherever possible. You know, doing the laundry, carrying the shopping bags, all of these activities help to improve your muscle mass, which then improves muscle strength and bone strength, and it also improves cardiac health, gut health, lung health, brain health, and your metabolism. I've also just added in a little bit here about massage and deep breathing. And these are helpful because what they do is they help in the circulation of lymph, which is part of the immune system. And again, it will then help to maintain a healthy immune system. So let's move on to stress. Well, what is stress? The mechanisms of stress. So there's a little bit of science here. I'll just try to keep it brief. But stress. So when we're feeling anxious, what happens is our body excretes something called adrenaline. Now, adrenaline in a dangerous situation is actually very good. So if we were being chased by a lion, you would want adrenaline circulating in your body, because what it does is it gets your hearts racing, it pumps the blood around quicker, your lungs, your breathing rate increases, your eyes, your pupils dilate, and it means that you flee, you run away from that danger. But when that stress persists, as often in our modern lifestyles, we are surrounded by stress, that stress then tips the body into chronic inflammation because the adrenaline hasn't stopped. So that is when we then start to run into problems. But there is another part of the nervous system that can counteract the stress from the adrenaline, the sympathetic nervous system, and that is called the parasympathetic nervous system. And by stimulating this, we can actually counteract all the negative impact effect of acute stress. So how do we do that? Well, deep breathing is a very, very good way of reducing stress. There's the box breathing method, where you breathe in for 4 seconds, you hold for 4 seconds, you breathe out for 4 seconds, and you hold for 4 seconds. Also something called 4-5-6 breathing, where inhaling for 4 seconds, holding for 5 seconds, and exhaling for 6 seconds, again, stimulates the parasympathetic nervous system. If you're struggling with that combination, you can make it 3-4-5. Also, keeping a journal, you know, having a gratitude diary has been shown to be helpful. It doesn't have to be anything fancy. You just need to write 3 or 4 things in the day that have made you feel grateful. You know, perhaps the sun was shining today, or, you know, your spouse made you a lovely cup of tea in the morning before lunchtime. Or you know, just that you saw a daffodil today. It just has to be something simple that's giving you gratitude. But there's also evidence that stressful events, if you write those down as well, that can be cathartic. We know that spending time with family and friends is beneficial and alleviates stress. Volunteering is very good. Again, it alleviates stress. And in Japan, they practice something called forest bathing. Being with nature, being in a park or woodland, all of that has been shown to decrease stress, because the plants and the trees, they emit something called phytoncides. These are chemicals which boost our immune system and also alleviate stress. And in Japan, they actually use that as a first-line treatment form for depression instead of medication. Again, listening to music, dancing, art, playing a musical instrument, exercise, yoga, meditation, mindfulness, all of these are very helpful in decreasing stress. So relationships, why is that important? Now, I do apologize that this was version 1 and I don't have the slide that I was going to show you, but I'll just quickly talk about it. Loneliness is a huge problem, and this pandemic has actually shown how much of a problem loneliness is, with the ensuing lockdowns. And being part of a community or culture like the Asian community, it's really important for us to keep healthy, both physically and mentally. And loneliness has actually been shown to increase the risk of developing heart disease, stroke, and blood pressure. And there have been studies that show that living alone and having poor social connections is as detrimental to our health as smoking 15 cigarettes per day. And also it's important to remember, I think, that loneliness, we often associate it with the elderly, but any age is affected by loneliness, and the young are just as vulnerable to this as the elderly. So how do we counteract loneliness? Well, by fostering positive relationships. There are 5 communities around the world which are known as the blue zones. They are Loma Linda in California, Nicoya in Costa Rica, Sardinia in Italy, Ikaria in Greece, and Okinawa in Japan. And what's special about these areas is that they have high numbers of centenarians, meaning they have high numbers of people that live to the age of 100 or beyond. And it's not just longevity, they actually enjoy a good quality of life. They have very few chronic illnesses, and whilst also enjoying a long life. And one of the main factors that attributes to this is the fact that they have a strong sense of community. They place a huge importance on the relationships that they foster with their families and their wider community. And having a sense of purpose and meaning is so important to maintaining those positive relationships. And studies have shown that, as I said, volunteering is very helpful, but also just random acts of kindness can bolster our happiness. So if we quickly move on to substance use and misuse. Again, sorry, the slide is missing on this version. Smoking is detrimental to health. We should just avoid it. It's linked with so many cancers. It's full of chemicals that are what we call carcinogens, which we know directly cause cancer. Alcohol. Alcohol in excess can be problematic. It's detrimental to health. Now, some studies have shown that alcohol in moderation, drinking between 1 and less than 5 units a week, may be beneficial for cardiovascular disease. But I have to say, when you look at the detrimental effects that alcohol can have on other conditions like cancer and chronic disease, then you have to just weigh up whether it is beneficial or not. But drinking in excess is definitely something to be avoided. So really, as we sort of come to our final thoughts, I just wanted to touch on something called epigenetics. Now, epigenetics is the science of the environment, the role it plays on our genes and whether they manifest in chronic disease. And an obesity researcher called Dr. George Bray in 2004, he coined the term Genes load the gun, but environment pulls the trigger. So what he was saying by that is that, we know that of chronic diseases, 10 to 30% of diseases due to genetics, but actually 70 to 90% of that is due to our lifestyle. So it's very much in our control. And just because your parent might have had a heart attack, that doesn't automatically mean that you will too. You may have inherited the genetic tendency. However, the choices that you make in your lifestyle, as you've learned through this presentation, will dictate whether will determine whether that disease is manifested in your life or not. So just as the presentation comes to a close, I just wanted to remind you of the 6 pillars of lifestyle medicine: sleep, nutrition, physical activity, stress management, positive relationships, and the avoidance of risky substances. And these are all things that we know, and they're in our control, and we don't always manage well. But I hope today I've given you some tips that will help you in your journey to maintaining good health and navigating your way out of a world of chronic disease. And just to finish, a final slide. I think this quote by Mahatma Gandhi is very timely and very special. It is health that is real wealth, and not pieces of gold and silver. Thank you very much for listening. I don't know if anybody has any questions that they wish to ask. I can try my best to answer.
I think Tejinder, you had a question, Tejinder Chandiok. Can you unmute yourself, please?
Yes, sir.
Yeah. Go ahead, please.
Do you want to stop sharing the screen?
Yeah, that's better.
Right, so has anybody had any questions for me?
Yes, Tejinder is going to have a question. Yeah. Okay, sure. Tejinder, go ahead, please.
In terms of various foods we eat to change our lifestyle, we do have, you mentioned a lot of Indian spices with triggers to help reduce the inflammation because they have got those elements of in there like ginger, garlic, turmeric, etc. What other foods are there which increases the production of juices and secretion of juices in your mouth, which changes the food kind of shape or quality or quantity when it goes to the gut and then goes into the intestines, so that it helps you for not only absorption, but it aids in digestion because the triggering of stimulation of the juices is very important. And that's why we try to eat delicious foods, not just to fill our stomach in, but also to make sure the food eaten has got a lot of benefits to be duly absorbed and digested. Do you suggest any things which help not only aid digestion, but stimulation of digestion?
Yeah, that's a very interesting question. I mean, really, it all goes back to having a diet that is as close to being unprocessed as possible. So in its whole content, whole foods, lots of plant-based foods, lots of herbs and spices. You want to be aiming to have variety. That's the key. So, cumin, coriander, parsley, as many different varieties as possible. And the key is actually to do with the processing of food. We've got to try and stay clear of having processed foods, because that's actually what then damages the gut lining, and then that's what then also has an impact on conditions like reflux. So if we stay as close to possible as having whole food, that is the best. So there isn't a specific food per se, it's more just that variety of plant-based foods, which is very important, and limiting animal products as much as possible because of the saturated fat in those products.
Sonia, there's another question here. If dairy is...
One more question and then I finish. Sure. Sorry. Dr. Sonia, I find lately that a lot of our children, particularly, the age we have gone by is a different stage, but nowadays children are turning to, I don't know how to summarize, vegan and gluten-free foods is increasingly becoming very kind of either popular, or people are getting allergy to normal, like wheat allergy or whatever. So where are the guidelines or kind of limitations or boundaries to work on these children or people who are more prone to eat gluten-free, vegan kind of foods, etc.?
And that's very interesting. So veganism is a term which encompasses a whole spectrum. It's based primarily on the concept of eating plant-based foods. And actually, the World Cancer Research Fund have actually said that we should all be focusing on plant-based foods and minimizing or eliminating animal products, because particularly red meat and meat that such as bacon, sausages, processed meat, they've actually been proven to be what we call type 1 carcinogens. You know, they've directly been shown to cause cancer. So you can, and the British Dietetic Association have actually said that it's possible to eat a well-planned, balanced, plant-based diet at any age of your life, and it is healthy, and it will provide you all the nutrition that you require. So I think what's happening with the younger generation is that there's just more of an awareness now of what we're eating, how it's being sourced, where it's coming from, and what it's doing to us. You know, we can't ignore the fact that there is a growing chronic health disease epidemic in the West. And, you know, you just look at America, the problems they have with obesity, diabetes, and cancer, and even just in our country as well, it is a huge problem. And it is linked to what we're eating. You know, if we're going to be eating unhealthy processed food, McDonald's, then we are going to have problems. It does affect us at the cellular level, because food is information, and it really does have an impact on our biology. And that biology doesn't just affect us, but it actually affects generations to come, because this is where epigenetics comes into play. What that food does, it switches on different mechanisms and different genes, which we then pass on to future generations. So, you know, whatever your eating pattern is, you know, nutrition is highly controversial. You know, everybody has an opinion on what you should eat, what you should not eat, what the best diet is, whether this is a fad or whatever. But unanimously, whichever camp you come from, everybody is decided on the fact and is united on the fact that we should all be eating more plant-based foods. We just don't have enough fiber in our diet, you know. And there are certain tribes around the world, there are a few tribes left, who they enjoy such good health because they have huge amounts of fiber in the diet. You know, these are sort of tribes that are hunter-gatherer tribes, and research has been done on them, and they've shown that their gut microbiome constitution is so much more different than ours, and it's so much more varied, and that's why they have fewer chronic health conditions, because of the diversity in the gut microbiome. Now, so gluten is a different issue. Gluten, celiac disease, there is a genetic aspect to that. But we don't necessarily advocate that everybody should eliminate gluten. It's only if you if you feel that if you're developing symptoms, if you're having bloating or skin problems or reflux or altered bowel habits, then you should go and see your doctor to be checked in case it is a gluten problem like celiac disease. But gluten in small amounts, is not in itself, shouldn't be harmful. But the problem is that even wheat and bread, chapati flour, what's happened is it's being stripped of its fiber. So we should really be eating whole meal grains, whole grains. So having brown rice instead of white rice, having brown bread instead of white bread. And that's where the problem lies really, because in the standard American diet, which we all adopt in the West, all the goodness has been stripped out of these foods. So yes, we're having white rice, we're having white pasta, we're having white flour in our cakes and our biscuits. So we need to go back to having the whole grains of those foods. And that's the key really. It's whole food that's centered around a plant-based way of eating.
Please do leave some kind of website you have where we can visit for some of the work you have done on the lifestyles. So that website, if you can share with the Brotherly, it'll be brilliant. Thank you.
No problem.
Sonia, there are a few questions on the chat you can see on the yogurt and which oil we should be using, on the vitamins.
So, I mean, dairy, it's a contentious one, the dairy industry is very powerful, particularly in America. So they will say to you that dairy, it's a rich source of calcium and it's necessary. But actually, dairy is a huge problem around the world. On average, about 70 to 80% of us humans have lactose intolerance, because we were never actually designed to digest cow's milk beyond the age of 1 or 2, beyond weaning. After weaning, we lose lactose, the enzyme that breaks lactose, which is the sugar that's found in cow's milk. And dairy is made from cow's milk, cheese is made from cow's milk. So if you go to the east, the eastern countries like China, Singapore, all of that southeast part of the world, their dairy consumption is almost minimal, because they have a high incidence of lactose intolerance, but also they just don't, it's just not been part of their culture to have high consumption of dairy. And the Indian vegetarian diet is very rich in dairy. And the reason problem is that it's very high in saturated fat. And we know that saturated fat can lead to diabetes, because what it does is it alters the cell, the membrane, the structure of our cells. It stiffens them, it makes them hard. And then that blocks the insulin from doing its job to allow glucose to come into the cell. So the dairy can then lead on to diabetes, heart disease. It's also been linked to cancer as well. It contains something called insulin-like growth factor, which is fine for calves. Baby calves need that to grow, but for human beings, what it does is it makes our cells proliferate and go out of control. So there's been a link showing that it can be linked to cancer as well. I mean, so it's a difficult one. Some people like dairy, and that's fine. I think you just have to be aware that if you're getting symptoms like bloating or itchy skin, think about your dairy intake. That could be having an impact. And calcium can actually be found in many other sources of food. Broccoli is rich in calcium, oranges have calcium. There are plenty of plant-based foods out there that have calcium as well. So it's not a necessary requirement of a healthy diet.
What about the cooking oil, Sonia? What is the best cooking oil for South Asian food?
Yeah, so again, oils, animal fats, if you're cooking an animal fat, then that's a problem because it's the saturated fat aspect of it. Cooking with oil, there are some camps that say you should not cook with oil. Now, those are particularly for people that have heart disease, because oil can be implicated in damage to the blood vessels, which then allow plaques to build up, which then lead on to heart disease. But, you know, I think you have to be practical about it. And, you know, sometimes we do need to cook with a little bit of oil. Olive oil is one of the best and healthiest oils to cook with. Also rapeseed oil. I would stay away from sunflower oil and vegetable oil because they are very rich in something called omega-6. And omega-6 are a type of short chain fatty acid, which they have to be in balance with omega-3s, but some oils have too much omega-6, which then put our body into an inflammatory state. So ghee, no, because ghee is clarified butter. It's basically, it's butter that's been clarified. So again, I wonder if in India, that's part of the problem, you know, they have with their increasing heart disease now because they cook with ghee. So yeah, I would stick to olive oil, a good quality, and you want to have it cold pressed, not refined, because the refining process, it adds chemicals to the oil, but also again, it takes away the goodness from the olives as well. So you want to have cold pressed olive oil or cold pressed rapeseed oil. Does that answer?
Yeah, there's another one here on the multivitamins. Are these recommended? If so, how much? Which ones?
So again, I mean, the government recommends that children up to the age of 5 should be taking a multivitamin, and it doesn't provide any other guidance for age groups beyond that, other than vitamin D that we should all be taking through the autumn and winter months. But I actually say, you know, we should really just take vitamin D because of our skin color. We should just take it throughout the whole year. Vitamin B12 is really important, particularly if you are predominantly on a whole food plant-based pattern of eating. And iodine is very important if you're on a whole food plant-based diet as well. And then possibly omega-3s as well. So if you eat fish, then a fish oil, or if you are a vegan, then you can get algae-based omega-3 oils. And actually fish get their omega-3 directly from algae. So when people say that you need to eat fish to get your omega-3s, that's not strictly true. You can go directly to the source and get algae-based omega-3s. And also, I mean, seeds, you know, flax seeds and chia seeds, these are rich sources of omega-3s. And also they've been shown, flax seeds have been shown to decrease blood pressure. Just sprinkling 2 tablespoons of flax seeds on your breakfast, your porridge or your cereal every day can also help improve your blood pressure. So I can't really recommend a particular brand of vitamin. You know, if you're having, the idea is that if you're having an abundance of fruit and vegetables, and pulses and whole grains and herbs and spices, you're going to be getting all the nutrition that you require, with the exception of vitamin D and B12. And B12, everybody, irrespective of your diet pattern, whether you're a meat eater or a vegan, everybody over the age of 50 should be taking vitamin B12, because there's something in our gut called intrinsic factor, which is required to absorb the B12. And as we age, that intrinsic factor decreases. So everybody over the age of 50 should really be taking a vitamin B12 supplement. And you're better off taking it as a spray rather than as an oral tablet, because it won't be as absorbed as effectively because of the decreased intrinsic factor. So those are the ones I would really say you have to be careful you have in your diet vitamin D, B12, make sure there's iodine and omega-3s, and everything else you should really get from your whole food plant-centered diet. You know, if you're having plenty of vegetables, pulses, grains, you will get everything else you need from that diet. And nuts, you know, nuts, walnuts, almonds, Brazil nuts, these are all very, very good for our health as well.
A couple more questions here. One is on what would be the good alternative to carbohydrates such as rice and roti?
There's nothing wrong, as I said, in having rice or roti, but rather than having the processed flour, having the white flour, have the whole flour. So, you know, have brown rice instead of white rice. Have I don't know if Elephant Atta or whichever brand you take, you know, if they do a wholemeal version of the chapati flour rather than the white version of that flour. But carbohydrates are important. We need carbohydrates. You know, carbohydrates contain fiber, and fiber is the key to having a healthy gut microbiome. If we don't have enough fiber, we're not going to have a good gut microbiome. And the gut microbiome now has been shown to be the thing that, you know, decides whether we get chronic disease or not. It's so important. We never knew this before, you know, 30 years ago, but there's so much evidence now that the gut microbiome plays a huge role. So, you know, carbohydrates are found in plant-based foods, fruits and vegetables. You know, having a sweet potato is rich in carbohydrates. You know, have that if as an alternative if you want. But as I said, there's nothing wrong with having rice. Just have brown rice, quinoa, buckwheat, all these other pearl barley, all these other alternatives are very good as well.
Say another one, Sonia. It's a medication for diabetes is mainly metformin, which is injurious. Is there a friendlier medication?
I mean, I don't obviously can't comment on the individual's medical condition because I don't have their notes to hand. But you know, I wouldn't say to stop metformin, because if your doctor has put you on it to control your diabetes, it's important. But it's important to know that every medication we take has a side effect, and some of the medications that we're prescribed have an effect on our gastrointestinal tract, on our gut microbiome, and metformin is one of those drugs. So what you really want to do is look at your lifestyle. You know, do everything possible that you can to support having a healthy gut microbiome, and by doing that, you might find that your blood sugars start to regulate and your diabetes improves, and you might find that you might be able to wean off your metformin. And after actually lifestyle medicine has been proven to reverse diabetes in some people, so it does work. So up your fruit and vegetables, exercise, go for a walk after you have your meal, after dinner. Going for a walk stabilizes blood sugar levels. Manage your stress levels, sleep well. I mean, as I said, sleep is so fundamental and it's so undervalued. But I think if you get sleep right, everything else will fall into place. If you're not sleeping well, it's difficult to eat well, it's difficult to exercise, it's difficult to manage your stress. So for me, I think sleep is the key. If you get that, then you can also make other changes, and they will all help with your diabetes. But I can't say that there's a particular drug that's going to be better than the metformin.
I think that the last couple of questions, I think it's that people are warming up now. So, and another one is, should we eat less potatoes? And in terms of non-dairy milks, what should be your advice? Soya, almond, or others? So potatoes and other form of milk.
Yeah, I mean, couscous, it's a good healthy option. The key is to have variety. and potatoes. So potatoes are like a white carbohydrate. So they release their sugar much quicker than, say, something like a sweet potato. A sweet potato is gives you more of a prolonged energy release. So that would be preferable to potatoes. But I'm not saying to you to stop eating potatoes, because it's still it's a plant-based food. It will help. Everything in context. You know, if you're having aloo paratha morning for breakfast, then you're having it for lunch, and then you're having another 2 aloo paratha for dinner with your meal, and then you're having samosa and pakore. You know, it's that type of eating pattern that needs to be addressed. It's the variety, and you know, yes, have your potatoes, but perhaps not as often. Vary it. Try having a sweet potato instead. You know, if you're making samosa, rather than frying them, deep fat frying them in vegetable oil or sunflower oil, why don't you try air frying them, or putting them in the oven or the grill and using sweet potato as a filling instead of normal white potatoes. But yeah, and in terms of non-dairy milk, yeah, oat milk is really good. It's very popular. Soya milk is good as well. Almond milk. I mean, all these are good alternatives. You just want to check. I mean, I know for oat milk, they actually it's actually fortified with some vitamin D and vitamin B12 and some other essential minerals and nutrients. So just look on the packaging and see which milk will give you some of those fortified nutrients as well, which are essential. Is there any?
I think
there was a question.
Is there any question you'd like to see there which we have missed, Sonia, so we can close it?
I think there was a question about lifestyle medicine education being mandatory.
Yeah.
Yes, I think it should be. You know, we were never taught. I don't remember being taught any of this in medical school. We're just not taught it. If you are, it's touched on very, very quickly, probably an hour or two, and that's it. It's so critical. It's key to managing chronic health, and the link between how we're leading our lives and chronic disease is underestimated. So yes, and there is movement. There's grassroots movement now. There's a younger generation of doctors coming along who are very keen on this way of practicing medicine. But the key, I also have to say that this is not alternative medicine. This is evidence-based medicine. There is a robust evidence behind it, and it's actually endorsed by the Department of Health. It's endorsed by the Royal College of GPs. You know, we're always taught to address lifestyle issues first for patients with chronic disease, but it's just understanding how to approach it and the link, which is very important. So yes, I definitely think it should be mandatory for all doctors, not just GPs, for everybody in their training.
Okay, thanks very much, Sonia. I think what we learned from you today is that I think all of us, we should reflect on our lifestyle. That is the medicine I think you're recommending, rather than adding few more onto the billion prescription we get every year from NHS, and that's the one way we can help NHS and save it, really. Bhupinder, is there anything you want to add? And otherwise we close it.
Yeah, well, thank you very much, Sonia, for a really wonderful presentation. Just want to remind everyone that they can keep in touch with the association on Facebook now, and obviously on YouTube, and our website is listed there. Please do subscribe to our channel, because we've got a lot of videos now. And so moving on, just to basically say thank you to everyone who's attended, and look forward to you all attending our next events in the near future. Thank you.